हाय गाइस, दिस इज बिस्मा एंड बचपन से ना मुझे सवाल पूछने का बड़ा शौक था एंड ट्रस्ट मी आई हैड अ लॉट ऑफ देम बट ग्रोइंग अप एज अ वुमन यू रियलाइज दैट फॉर अ लॉट ऑफ टॉपिक्स you need to zip your lips. So when I joined Practice for her, I decided I'm going to get all my doubts cleared. And why just me? All of us ladies deserve to get our questions answered. And for that, we have with us Dr. Sithara.
Hello everyone, I'm Dr. Sithara. I work at Proactive for her as a consultant gynecologist. Today, I'm going to answer a few questions that is being asked by my friend Bisma.
So today, Dr. Sithara, we are going to be discussing all things about periods. Okay, so Dr. Sithara, my first question to you is about every menstruator's best friend, Meftal-Spas. And a lot of us take at least like 1 or 2 tablets in a cycle. So I wanted to ask if it's okay to, take Meftal-Spas in every cycle, or can it have any harmful effects in the long run?
Meftal-Spas is a very safe drug of choice. The content here is mefenamic acid and it can be certainly used. Pain during menstruation or dysmenorrhea could be related to several factors, that it could be related to fibroid uterus or adenomyosis, endometriosis too. So it is better to consult your gynecologist and rule out all pathological factors that is related to pain during menstruation and then go ahead by taking mefenamic acid.
As you said, Dr. Sithara, that it's okay to take Meftal-Spas, but we need to understand the pathology of the pain behind our periods. So I wanted to ask you, is it okay to have pain during periods? Like, is it normal?
Yes, it is certainly okay, because there's a concept that when you ovulate, you have pain. So a minimal amount of pain where it's not interfering with your day-to-day activities, it is certainly okay to have pain during menstruation. But if the pain is very severe and if you're unable to tolerate it, then certainly it needs to be investigated. You need to rule out few factors that is causing pain during menstruation. As I just mentioned, it could be because of endometriosis, adenomyosis, fibroid uterus. So a minimal amount of pain where it's bearable, if you're just comfortable using mefenamic acid, then it's fine. But if at all the pain is very severe and it happens every month and you feel that there's something wrong, then please do kindly consult your gynecologist.
Thank you so much, Dr. Sithara, for explaining all of this in so much detail. There are a lot of people who also don't have any pain during their periods. I mean, they're very lucky. And I have one such friend. In fact, she told me that she gets her periods like once in 3-4 months, once in like 6 months sometimes. So she has a very irregular periods, and that's been the case since her menarche. And like, she loves the whole #no period life, but she wants to understand that is it okay, or does she need to show to a doctor, and can it harm her fertility in like the future?
Yes, many women actually enjoy this period free life, but if you ask me, doctor, is there a problem in future to conceive, then the answer is yes, because the concept here is when you ovulate regularly, it becomes easier to conceive. Because what does ovulation mean? Ovulation means every month there is an egg that is being released. So when you do not ovulate, or when you do not have your regular menstrual cycles, that means there is a problem to conceive too. So you certainly need to investigate what are the reasons behind this irregular cycles, and in case if it is just a hormonal imbalance, it could be certainly be treated. So just in a nutshell, it is definitely important to have a regular menstrual cycle to conceive. And if you're not having a regular menstrual cycle, you certainly need to visit your gynecologist.
Since we're on the topic of irregular periods, I wanted to ask you, Dr. Sithara, that does irregular periods always indicate PCOS? And also that if somebody has PCOS, is it important for them to have like irregular periods as a symptom?
Irregular cycle is not always indicative of PCOS, but most of the women actually think that if she is having irregular cycles, then it's certainly PCOS. Not necessarily. PCOS is more to do with your hormonal changes, where in your ultrasound probably he or she, the doctor, diagnoses that there is a polycystic ovarian disease, or what he or she finds is polycystic ovaries. And also clinical symptoms of PCOS could be acanthosis nigrosis, that is blackish discoloration of the nape of the neck. There could be abnormal facial hair distribution or abnormal fat distribution of the body too. So we actually need to consider many of the things, that your scan findings, your clinical symptoms, to say that you have PCOS or not.
Okay, so Dr. Sithara, I have a slightly silly question to ask. So, no uterus, no problem. So, I was thinking that I wanted to ask that if somebody gets a hysterectomy, will they not get periods again?
That's a very nice question, Bisma. Let me just go a little bit about the physiology of menstruation. Basically, if you have to menstruate every month, you certainly need to have a uterus. That's because menstruation is nothing but shedding of endometrium, that is this layer of endometrium you shed every month, and that is what is called as menstruation. So the answer is yes, if you have to menstruate, then you certainly need a uterus. No other way go.
And the last question, and I think it's a very common and fairly important question as well, that which is the best menstrual product as per you, like sanitary pads versus tampons or menstrual cups?
Considering the lifestyle women have these days, I think I would suggest menstrual cups. Menstrual cups are more hygienic. You can use it all the time, and also you can reuse it too. So definitely menstrual cup is a good option.
Thank you so much, Dr. Sithara, for taking out the time and also answering all of my questions with so much patience, and also for not judging me at all. Thanks a lot.
Thank you, Bisma. It was pleasure talking to you.
I got all my questions answered, and I hope you guys did too. If you like this video, give us a thumbs up. And what is the next topic that you would like us to cover? Tell us in the comments. And for more such videos, subscribe to Proactive for Her today.